So what happens when you ring us and we're ready to start the treatment, we will then organise for the drugs to be delivered to you from the drug company. When you receive the drugs from the drug company, you'll get a kit like this, and inside it will be all of these medications that you need for the cycle. They will then tell you some of the medication need to be stored in the fridge, some of the medication can be stored in the cupboard, all right? Okay, so what I'm going to do for you is just explain the drugs that you're going to start off with. And when we see you for your first appointment, we tend to do a scan to check that everything's okay, and providing that scan is okay, then we'll show you how to do your first lot of medication. The first lot of medication you'll be starting with is this Gonal F pen. This is FSH, so it contains follicle stimulating hormone, and the purpose of FSH is to make your follicles grow. So the dose of this medication is decided upon based on your age and the hormone blood test that we did. We select a dose rather, that we think will work for you. These injections are taken once a day. So when you open the box, you will see you've got a set of needles, and this is a pre-filled pen.
How big's the needle? Is it quite big or?
All the injections that you need for the cycle are what we call subcutaneous, which means the needles are very shallow and it's just inserted under the skin surface. So it doesn't go deep into any muscle tissue, it's literally just underneath the surface. So it's similar to injections that diabetics take every day, all right? And we will actually show you, like I said, on the day that you're due to start. So when you open the box and you've taken out your pre-filled pen, this is your pen, you can see there's some medication inside. So the liquid inside is the medication already pre-filled.
Okay.
And then you will take one of these needle tips. So I'll just show you that now. Pull off the backing, and then you attach it by literally just screwing it on. You will then take off the outer covering, and then you take off the inner covering, and there you can see the needle, which is a small needle, exactly. So these needles are used once only, and anything that's discarded gets into the sharps bin here.
I've heard there's a drug that you can actually sniff as opposed to inject in. Is that right?
There is. There's different regimes. We tend to do what we call a short regime, and for simplicity and quickness, we tend to use these injectable drugs. There is a nasal spray that you can take called Cineral or Buserelin, which does the same thing. It's a control. It stops you ovulating, so it controls your hormones, if you like.
What would determine you using that one as opposed to those?
Well, it's down to the clinic, basically. Some clinics prefer the use of the nasal spray, and some people prefer the use of this one.
Would a donor get a choice?
Good question. If some patients are really needlephobic, then yes, we don't mind using it. But we do find we kind of get a better, shorter reaction with the short cycle using this drug than using the nasal spray. The tendency for the nasal spray mostly is for the long cycle, where you start the drugs on day 21. You have 2 weeks of suppression when your hormones are wiped out with the nasal spray. Then you come back in for a scan to check that you are suppressed, and then you have 2 weeks of this stimulation. So that makes the cycle at least 4 to 5 weeks long. Whereas when you do the short cycle, you're literally starting with you stopping your period or giving a medication to make you bleed. You start on the second or third day of that period, and it takes you 10 or 12 days later and you've gone through the egg collection. So the short cycle using these drugs is a lot simpler and shorter and less disruptive for yourselves. Because these are subcutaneous injections, we would say to you to inject. Easiest place to inject is either beneath your belly button, so in your tummy area, as in lower tummy, so that's beneath your belly button above your pubic hairline, or you can also do in your thigh. So if you do in your thigh, we would normally say to alternate. So one day you do your right thigh, next day the left, and alternate it back and forth. And the same when you do your tummy, we would say inject one side, say on the right side, again then alternate it the other side, so it's not too uncomfortable. So basically anywhere across your lower part of the tummy you can actually inject.
Am I likely to get any side effects from this? Does it bruise you or?
Well, some people, after a few days, you do get some bruising in your tummy. But it's just like, you graze yourself, you will get a little bit of bruising. So it's not major reaction, just like local area, basically. So it might feel a bit sore to touch for a day or two, but it's nothing terrible, nothing that's going to stop you doing your normal everyday activity. The actual drugs themselves, though, what it does, like I said, is to make your follicles develop. So after a few days, maybe 5 or 6 days, you may notice that you feel a little bit heavy, lower abdomen. You might feel a bit like your tummy's distended. Some people find they feel tired when they take these drugs.
Is that why they say it's important to drink lots of fluids?
Well, it's important to drink lots of fluids because we want to rehydrate you and make sure that you feel well. Because if you can imagine, your ovaries are enlarged and lots of follicles are developing there. Drinking lots of fluids help to make sure the rest of your body is rehydrated and generally makes you feel better. Also, as well as feeling bloated, you might feel tired, headachy sometimes, and sometimes people find their appetite changes, so they might find that they eat more. But there's nothing really that's in this that really stops you from carrying on with your normal everyday activity.
Okay, providing you show for your scans and make sure you're having the regular checks, then those things
you should
can
be fine.
maintained.
Exactly, you should be fine, and also drinking lots of fluids as well. That helps to make sure that you stay well.